Good morning, everybody, and welcome to our weekly live question and answer series where we sit here and look for questions from you to ask Dr. Ellithorpe. And of course, we just want to make note that this is not meant to be medical advice. We do want to encourage you and insist, in fact, that you maintain a relationship with your healthcare provider to follow up on these questions. What we're doing here is for education, information, so we can all learn together how Dr. Ellithorpe might approach your question as a functional medical doctor with her patient here in the office. So thank you so much for joining us today. Please tell your friends and family to join in. This is open to anybody, not just our patients. And you can participate with the question and answer in a couple different ways. The best way is to use the chat feature off to the side of YouTube. You need to be logged into YouTube to do that. But when you post your question there, I can see it come in real time and then ask the doctor that question. If you're having difficulty with that, you can email in your question as well too. I do have to say we get tons and tons of emails though, so there is a chance that the email might not make it or for the very next episode, but we do our best to make sure that we don't miss any of those. That email address is office@tlcdoctors.com. That's office@tlcdoctors.com, and just make sure that you put in the subject of that email YouTube question, Q&A for YouTube, something along those lines, and we'll make sure it gets routed to us here. All right, now that we have that out of the way, good morning, Dr. Ellithorpe.
Good morning, Callan.
It is a good day, isn't it?
It is a blessed day.
Yes, and I do see that we're getting quite a few questions coming in already, so what do you say we dive in?
Yes, absolutely.
All right, first question here is from Harlow, who asks, what can be used in an IV other than chelation for inflammation and severe pain of the joints and muscles?
What can be used in an IV outside of chelation for pain of inflammation in the joints and muscles? I would say the magnesium or the vitamin C drips. These are both powerful intravenous applications of micronutrients doing an anti-inflammatory work for the body. So that's where I would go on that answer.
And we have what's called the Myers cocktail IV. That is a very heavy magnesium cocktail that is great for relaxing muscles, smooth muscles, that type of thing. You're going to get, well, as you mentioned, with vitamin C, great anti-inflammation. Of course, when you get into the higher doses of vitamin C, that's actually causing a pro-oxidative response too. But the long-term effects are great.
Disinflammation.
Disinflammation.
Yeah. So, the magnesium comes as a 4, I believe, a 6,
7, a 9. We have a couple just straight magnesium drips.
Right. So it depends on the person, and it is very relaxing. And as your blood vessels relax as well, because there's smooth muscles in the blood vessels.
Right.
That also promotes circulation, and circulation will deliver repair material and nutrients for restoration of cell membranes and tissues, and it'll remove. So you have to drink enough water as well.
Yes.
But I would also say they need enzymes. Systemic enzymes like Vitalzyme, Proteozyme, Vascuzyme, on an empty stomach.
And why not, if you're here at our center, we have the Beamer mat that helps with the microcirculation using electromagnetic frequencies to help stir that peristaltic action of the capillaries.
Yeah, because the capillary beds, as we understand them now, these are actually, there's no muscle, there's no smooth muscle. There is actually, you need to be well hydrated. It's an electrochemical motion, and that is amplified by this natural frequency that you're pointing out. Yeah, the Beamer mat is very good in anti-inflammatory.
There's something here that's quite underused. We have it. I think not a lot of patients know about it, but while you're sitting there getting your IV, you can sit on this mat and enjoy that benefit.
Absolutely.
Now, what do you think about, we have glutathione IVs too, and those are very anti-inflammation.
Yes.
Antioxidative.
Yes, and you could say there are so many wonderful biochemical supports to enhance your aerobic cellular function and breathe. Okay, and so when you breathe and your little cells breathe, This disinflames the body. Glutathione, lipoic acid IVs, all these are very helpful. But as far as general response, I would go first to the magnesium drips, then vitamin C drips. But I'm never going to say don't do enhanced chelation. That's my go-to for all microcirculation, cell membrane, restorative action for delivering nutrients and removing waste.
Good. Okay. Sean asks us, Doctor, how many Argentine sprays in the nose and mouth should I apply for COVID-19 daily maintenance? And how many sprays when sick? The directions say 10 nasal and 30 mouth. Is this too much? Thanks.
No, it is absolutely non-toxic, and there's no limit to the number. I never count the numbers. I
think I do 3 or 4 sprays in each nostril.
I do at least 3 or 4 in each nostril. And if I'm using the spray in my throat, but I'll take the bottle and I'll just take a sip, gargle, and then swallow. So
you really can't overdo it.
You cannot overdo it. And so I would encourage you to be liberal with your preventative, at least before you go to bed every night, and it would be better morning and evening if you want to try and prevent viral illnesses of all nature.
We keep a big bottle of this it comes in many different sizes just for the liquid. I get a large, there's a 16 ounce, there's even a 32 ounce in my house. And then we just keep the nasal spray and the oral sprayer. We just refill it from there. When I do the oral spray, I actually breathe in a little bit just to get that mist into my upper respiratory.
Yes, into your lungs. I have a paper here. I brought it up last Monday night. The mode of antiviral action of silver nanoparticles against HIV. And this is from a publication called Journal of Nanobiotechnology from January 20th, 2010. So in here, the conclusions basically are these properties make them a broad spectrum agent not prone to inducing resistance that could be used preventatively against a wide variety of circulating HIV strains, but other strains, because the Bethesda Naval 2009 study with Ebola showed that it was very valuable. So it is that Argentine is nanoparticulate, which means
colloidal silver.
Not colloidal.
To be confused with that.
Not that colloidal is a bad thing. It's just more clumpy. It's cheaper. Okay. Nanoparticulate is a uniform dispensing of this in suspension in the water, and it's so beneficial. And that's probably why I stay so well so long.
Question from Lee that says, my SpectraCell micronutrients has showed deficiency, and then she lists a lot, but I'll say quickly the top one: selenium 73% deficiency, alpha lipoic 80%, borderline in several B vitamins, inositolic acid, fructose sensitivity, chromium, glutathione. So the question is, what should I do? Should I increase supplements? Well, I think the first thing is if you took SpectraCell, I'm guessing that you're a patient here, and then I would work with that doctor to adjust those, because a lot of those items are in like our TLC Energy Core or the methylated B complex, because we want to make sure, Lee, if you're not here, we don't know what supplementation you're taking, and unfortunately, there's a lot of junk out there. What say you?
I agree. You need to sit down with your physician who ordered the SpectraCell for you and to come up with a plan. And there's many ways to skin a cat. And the items you suggested, Talon, are very valuable. And we would repeat that to look at your improvement. We've been using SpectraCell for over 30 years, I would say. And we've been very able to help improve the antioxidant level of protection that patients have when they are using the guided, high-quality nutrients, and maybe some tailored little individual, like if she's so low on alpha lipoic, it depends on her situation. If she's having some metabolic syndrome, insulin resistance, I would choose to give her the alpha lipoic in TLC metabolic formula, which is very high, as opposed to just straight TLC alpha lipoic acid. So work with your doctor on that. There's many ways to approach this, so you don't have to buy so many supplements, maybe a good few. The number one thing, though, that I did on the SpectraCell when I published on it in 2000 in the American Nutraceutical Journal, I used the Juice Plus series. So with Juice Plus, I was able to achieve a very nice overall improvement in the antioxidant shield, and results were greatly improved across the board of all my patients. So talk with your doctor about that.
And just one final thought, SpectraCell, like many things, is just one data point on a patient. If you walked in and you're fine and you're healthy and you did SpectraCell and you see you have some deficiencies, okay, maybe your body needs a little bit more of that. We can adjust some supplementation, but I wouldn't get so focused on any one test. I would look at it as a good doctor would in the picture of the patient head to toe. What are they presenting with? What's going on?
Exactly.
Okay. Next question is from Lynn, and Lynn says, my 80-year-old mom is taking 2 Ortho Digestion tablets per meal. Her digestion improved for several months, now occasionally experiences constipation. Can the dosage be increased? Thank you.
Yes, you can. I take 4 or 5 with every meal that I eat. I typically only eat 1 meal a day, so I'm taking 4 or 5, sometimes even 6. Yes, but for constipation, the older you get, it's very likely dehydration. And so water would be the first route that I would encourage her to go into, is looking at the water her mother's using, and half her weight in pounds. So if she's 120 pounds, that would be 60. That means she needs 60 ounces of water every day. The other thing is if she could walk, motility, walking. And then finally, minerals, TLC multi-mineral. These are Albion amino acid chelated minerals, very high quality. Magnesium in these minerals, the zinc and such are all very beneficial in bowel movements. And again, I'll bring up Juice Plus. It's one of the benefits of Juice Plus is often relieving constipation.
Okay. Next question is from Robert, and Robert says, I caught Omicron and had a really sore throat. It felt like strep. In 3 days, the pain is gone. Just have a cough now. Anything you would do to get rid of the cough?
Well, it depends on how bad the cough is. If it's you're carrying on your conversation like we are without any interruption, and you're carrying your day through, but it's mostly at night and it's destroying your sleep, then I would try and get something to help you with cough relief at night so you get a good night's sleep. Well, you can use guaifenesin in Robitussin. Sometimes we add codeine to it. Guaifenesin with codeine is called Robitussin AC, and the codeine is a natural cough suppressant as well. So we could use that. The other thing is adequate hydration. And then mucolytic agents such as enzymes. Enzymes help break up the material of the mucin and help you to expectorate it so it doesn't accumulate and generate that tickle or that cough. Again, if you're without a fever, you're not having chills, myalgias, achiness, fatigue, and you're just having a cough, that's most likely a postnasal drip. Okay, tickling your larynx there, and that could be helped with things that are natural antihistamines that stop that release from the mast cells of the secretions of your nasal passages. And we use DHIS for that, quercetin. Quercetin also happens to be a natural antiviral. So there are many things you could do. Another suggestion would be the Argentine nasal spray to prevent viral emergence and to make sure that you keep a clean, as clean as possible, sinus so the postnasal drip doesn't occur. So see your doctor about that, but those are suggestions that I would give.
Okay, great. We're caught up on the chat section, so I'll go to a couple emails that we've received recently. We have one here from Lisa, and Lisa says, Juice Plus has come out with a new protein powder called Juice Plus Perform. Have you seen it, tasted it, or can you recommend it?
I'm waiting on the science, as I always do. The same goes for any nutraceutical that we incorporate into our medical management here. And so I need to see plenty of studies. Since I haven't, I'm not recommending it at this time.
Right.
And I would go from there, and just say, until I see the science, I have no reason not to use it, and no reason to use it. I'm neutral on it until I see it.
And neither have I looked closely at it. I would just say, when it comes to any kind of a protein powder, meal, supplement, I mean, what is the purpose of what are you looking for, right? And then does that meet those requirements? So most people are looking for a quick shake on the go, or maybe a pre-workout, something like that. Juice Plus, I'm sure they're putting their Juice Plus powders in there, so that's going to be great for it. But many of these, I'd say most of these meal replacement shakes are tailored to taste palatable, and the carbohydrates or sugars in them are just too high.
Yeah.
So take a look at the carbohydrates. Consider how you would compare it to a meal that you would eat for yourself, with some chicken and some spinach and maybe a little brown rice. How many carbs are in that meal versus a shake? Because it's really easy to drink a ton of carbs and get too much sugar.
And it's been estimated that the main source of the destruction of the American and Western civilization health that is imported or exported to the rest of the world is through the sugary drinks.
Right.
And that is what's harming so many people.
Yep.
So be careful. That's a good point, Talon.
And her last question is, my husband is fighting a headache and chills. I wonder if an infrared sauna for me at this point, currently feeling fine, would help me avoid being sick or cause symptoms to come faster. And will an infrared sauna help or hinder him when he is sick?
Well, of course, see your doctor, because I don't know who this is or what's going on. But the generalized question about infrared sauna health and your immune system, I think the science is well established that it enhances the immune system. One of the things it does is it naturally brings up your core temperature to a low-grade temperature of about 100, 101. And that will produce a cascade of cytokines, one of which is heat shock proteins. And these are very advantageous in antiviral and anti-aging components of the complexity of the human body. So yeah, I'm in favor, and I have my own infrared that I use.
Okay, great. Question from Dolores in the chat. She says, Doctor, I had a bad sinus and tested positive. I usually get sinus issues a couple times a year. Should I use supplements that can help?
I certainly would recommend the Argentine nasal spray for sinus to help decrease the viral, bacterial, and possibly even fungal load that your sinuses contain. I would drink plenty of water, half your weight as ounces every day. And I would take the systemic enzymes that will disinflame and help chew up unrepairable cell material. I would be very low carb because sugar depresses the immune system.
Yes.
I would also use, if you have sinuses, a food allergy test with your doctor to find out what you might be eating, or you could do the skin allergy test to look at what might be the seasonal pollens and stuff. And then we have desensitization drops that might help you there. Have a very good vitamin D level. Make sure you're on a very good vitamin D. And then the natural antihistamines like DHIST or Allergy DHQ. Allergy DHQ are natural products that we've tested that help with that as well. So I think amidst that, you would do quite well. Of course, I don't know who you are or what your comorbidities, if any, are. So you have to have your doctor help to watch over these things for you.
Right. And the first thing my mind went to was the Immune Protect, the TLC Immune Protect that we created as a all-in-one cold and flu sort of capsule that has a lot of those things you mentioned in them as well too.
Right, except the vitamin D.
Of course.
Yeah, because I vary the doses with my patients too much to be able to just put one set amount into it. But yeah, that would be a very good choice, is the Immune Protect.
Sean says, I hear Sally Fallon with Weston Price Institute discuss omega-3 and 6 fatty acids and the importance of keeping the ratios in check because many people consume too much omega-6. Any thoughts?
Well, that is a very misunderstood region because it's really not taught well or thoroughly to physicians. My father was in food research with fatty acids. You have to have the two essential fatty acids, linoleic and alpha-linoleic acid. One is the omega-3, that's the alpha-linoleic, and the omega-6 is the linoleic acid. Now, these are critical in cell membrane functions of the trillions of your cells, so you have to consume these. They have many double bonds in them, which makes them very unstable in light and around
Heat.
oxygen and heat. Yeah. So what happens then is if you're eating the egg yolk, you're getting that. If you're eating meat and fish and chicken with the skin on it and other types of live animals and fish and birds and so forth. However, they when they're used in processed foods, such as Ritz crackers or tortilla chips, Doritos, all these packaged cereals, packaged breads even, they hydrogenate these double bonds so they don't react with oxygen and the light and become rancid. And therefore, the omega-6s that are consumed are all hydrogenated, which makes them damaging. So we need the live, healthy, living, unhydrogenated omega-6 from eating your egg yolk, eating meat, eating fish, eating chicken to restore the health in your life. So it's like saying, is meat good? Well, you have to say, which meat are you talking about? The abused stockyard, antibiotic, hormone, restricted corn, grain-fed, terrorized poor little cow? Or are you talking about the happy cow running in the field through the day, meets the bull, and they play together, and then they go back in the barn at night? The essential fatty acid biopsies of those animals are very anti-inflammatory, very appropriate. The biopsies of the omega-6s in the abused USDA grade slaughterhouse poor cows is horrible and pro-inflammatory. So when you're reading books like the China study, they don't even address these issues, and it corrupts the message. They're like saying all meat is fat when it is only, they're quoting the data on the abused animals. Right. So it's a mixed bag. So eat organic, free-range, wild-caught, the sources of prairie-raised egg yolks and the like, organic as much as you can, and then you'll get the blessing of all these unhydrogenated, and stay away from processed foods. Just don't have it in your house.
Right. So just to sum up in layman's terms, what we hear a lot of from our patients, and what we notice is most physicians, unfortunately, don't understand the biochemistry of healthy fats, healthy lipids, and we've been sold a big fat lie the last couple decades that fats are bad, omega-6s and are to be feared, and limit them. So it's two different conversations. One is what's the type of fat that we're talking about? Mm-hmm. Is it a healthy type or is it a processed type? Because that's completely going to change it.
Totally different.
And the other thing is, it is essential for life. It is a truly only essential fatty acid, not fish oils,
right?
But linoleic and alpha linoleic acid,
yes,
are the truly essential ones. In fact, they're so important that you prescribe them to your patients and have them drink it, drizzle it on their salads, right. Take the capsules.
Yeah. That's the clinician's preference oils, and you could go on YouTube and you can listen to Professor Brian Peskin, Peskin, and you can get the lowdown on this whole history. But I heard and knew about this ever since I was a child, and it's just so sad. My father would do biopsies. One of the things is that we would get holy meat. My mother would laugh, because we get these steaks with cores poked out of them, and they would throw it away. So my father would take it home for us to eat, and we would eat holy meat. And these things were being biopsied and tested all the time. And the table conversation in my house as a little child was always, the corrupting trends of the food industry for prolonging shelf life. And that requires hydrogenation of the fats, which normal healthy fats would never do to you. So yeah, I've learned this, and maybe that's why I have such good health.
Okay, time for just a few more. John says he's recovering from Omicron, 9-day fever, 12 days post. Lost 10 to 15 pounds, doing basic fasting, no breakfast before getting ill. How should I be eating now during my recovery? Appetite for 11 days.
Well, I would be focused on a very low carb diet because sugars depress your immune system. So I would be eating wild caught prairie raised meats and poultry and eggs and wild caught fish with cooked vegetables so that your immune system is not being introduced to any more irritants, and use the systemic enzymes for the myalgias and stuff on an empty stomach every morning since you're doing intermittent fasting, drinking plenty of water, and you might consider make sure you're on enough vitamin D. Taking the Immune Protect would be very beneficial, and adequate hydration is always a key element. But that would be not knowing who he is in particular. And certainly if it gets much prolonged or you don't start gaining healthy weight, you need to see your physician.
Right. Yeah, and I think the key to when you're immune challenged or immune compromised is what we call the simple rotational menu. Combine that with either intermittent fasting or fasting. And we want to limit the types of foods and the ingredients that are being introduced to the body, because every single one of those ingredients has to be identified by our immune system. We know that about 80% of our immune system lines the gut.
Right.
So give your gut a break. The best thing you can do is take some time off from eating. Initially when you're sick, that's why you often recommend a clear liquid diet. But as you start reintroducing food, maybe only have an 8-hour or 6-hour window of the day that you're eating food. And then when you do that, pick a protein, a vegetable, maybe a fibrous carbohydrate, which is going to be your vegetables, and cook that and eat that and stick with that for a 24-hour period of time.
Right.
So you're not throwing all of this stuff in your immune system to figure out.
Right.
Okay, maybe one more here. I had my breast implants removed 2 years ago, and I'm feeling a lot better now. They didn't remove the capsules. Do you think I should go back and remove the capsules for better health? Well, that's a good question. Of course, the pros, cons of going under the knife again in surgery and what especially right now, what that will do to your immune system. But what do you think?
I really don't understand what she's saying by they didn't remove the capsules. So maybe there was fibrous tissue around the implant that they left there, which is your own reaction to the implant. If that's it, I wouldn't work to do anything with that except take enzymes.
Right.
But I'm sure if the surgeon removed your breast implants, they took the capsule and all that stuff that went with it.
If it's silicone, the bag that it's in,
Exactly.
well, everything else. I mean, I haven't heard of them maybe like sucking out whatever's in the bag, the saline or the silicone, and leaving the bag. They wouldn't.
No, I would talk with your surgeon and find out just exactly what that was, or get a printout of the operative procedure from the hospital that was done. Bring it to your doctor so that they can get a clear picture about what you're trying to ask, so that they can give you good advice. But I think it's probably the fibrous reaction of that is called a capsule. We always encapsulate disease in our body.
Any foreign body.
Right, yeah. So I think that's the best way to handle that.
Well, thank you everybody for joining us. That is just about it for our time today. Doctor has patients coming in very soon. Thanks for joining us. Tell your friends and family if this was valuable to you. Just take a quick second and hit that thumbs up button. That helps us spread the word. Even better if you subscribe to the channel, and you'll be notified of which videos you've seen or you haven't seen, or when we post new ones. Thank you. We're here every Wednesday morning at 9:45 a.m. Pacific time. Dr. Ella Thorpe does another special live Q&A on her own Monday evenings at 6 p.m. So you can also tune in 6 p.m. and that tends to be a little bit longer. Until then, everybody, we look forward to seeing you next time. Be well and God bless.
God bless.